I mean, are there vapors that come off of the mercury or anything that is harmful to you?
Potentially, yes. There are some dentists that are extreme and have put in all sorts of ventilation systems in the room, wearing all sorts of masks. There was a dentist probably 20 years ago that he lost his license for doing that. And again, that was the ADA trying to prevent him from saying what he believed about mercury fillings. I go and get checked out by physicians. I have all my metal levels checked, typically once a year to make sure I'm doing okay. Of course, we're doing everything we can from a patient standpoint. The only thing the patient's getting we're not having is the oxygen. But of course, we have our mask, and we're doing everything we can to quote unquote suck up any vapors or pieces as they're being removed. My levels, I've never had any treatment. My levels are very low, so I feel comfortable with the protocol we use is taking care of everything.
That's good. That's good. Is gold any better?
Gold's a good product. It's been around. It does not contain mercury. There's some debate. Yeah, gold will last a very long time. There's some debate that all ceramic restorations are actually a little bit better because they truly chemically bond to the tooth. But I think gold's a fine product.
Okay. Folks, if you look in your chat box, we're sending you some notes and some information. Like some of our guests have actually sent us some websites that they feel could be helpful. So we're sending that chat out to you, and you can check them out yourself. Okay. Someone asked, how can I contact Dr. Luna?
Of course I didn't put it on here, did I? I have a website. It's www.diamondsmiles.com. So it's plural, and on there should have all our contact information, address, everything else. Our phone number is 205-988-9700. I have a 1-800 number, but I truthfully don't remember it. And email you can send to would be information@diamondsmiles.com.
Okay, thank you.
Great, thank you.
Somebody asked, as a result of deep amalgam fillings, I have several root canals. How safe are root canals?
There's some debate about root canals and some of the chemicals that were used for them, and it wasn't the root canal material itself, which comes from a rubber plant. It's an inert material, meaning the body doesn't react to it. But the sealers or the cements that were used in root canal, there was a product not that long ago that if it was pushed out of the root tip could cause nerve damage and permanent numbness. That product's no longer on the market. And so at this point in time, the sealers and the root canal material itself are all, as far as we know, safe.
Okay. I have had composites in my mouth that had to be replaced twice. And with the controversies regarding fluoride, I'm wondering what composites you recommend, as I know they are not all the same.
I would probably have to disagree with that comment in the sense that most of the composites out there now have all gotten to about the same strength and the same properties. If you're having problems with the composites, then I hate saying I'd be more worried about the technique that they were being put in. There could have been moisture underneath it. It wasn't a dry environment, so they were leaking from the very beginning or had bacteria underneath it. If it wasn't bonded properly into place, that would be an issue. A composite itself should not break a tooth ever. It should not leak if it's done right. Over time, it can wear some. The nice advantage to it, if it starts to wear down, you can, without removing the whole thing, just add back to it and repair that small little area.
Great.
So I'd be more concerned that there was something going on with the way that the composite was being placed.
Got it. Got it. So it's a technique. Speaking about bacteria, folks, and here, let me put another plug. There is a technology that involves nano, they call it nano silver, not colloidal silver, but a special kind of nano silver. It's processed in a different way that has been found to be an FDA approved. It's found to be extremely effective against all kinds of bacteria, all kinds of harmful bacteria. That is, they seem to be selective. They attack the bad bacteria and they preserve the good bacteria throughout your body and in your system, and scientific research proves that. So, and again, that's on the website. It's called Winning the Fight Against Bugs with Nano Silver Technology, and I think dentists also take advantage of this technology as well. All right, someone's asking about can I view the rubber dam slide, please? Where can I find such an equipment and the rest of the equipment?
I wish I had pictures of that too. I don't know if we Googled it, if you would see a picture of it. It's basically a 6-inch by 6-inch just rubber sheet, and the dentist punches holes through it and has a little clamp that will wrap that sheet around the tooth itself.
Mm-hmm.
It does cover the entire mouth, but not the nose, so that you can breathe. Every dentist should have some. I mean, they were all taught in dental school to use the product. Mm-hmm. Most dentists don't use it, but they have it in their drawer somewhere.
Okay. Are there any health concerns with implants or root canals?
Implants are mainly a titanium post. At this point in time, they're showing truly no reactions to that metal with the rest of the body. The success rates with implants over the last 40 years has basically been about 96 to 99%. The failures usually occur with somebody who smokes or has severe illnesses such as diabetes, and also depends in the area of the mouth where they're put. So there's some areas where the bone is stronger and can support an implant better than others. Implants from that standpoint, I have not seen one documentation case or anything that says anything that's wrong with an implant. From a root canal standpoint, there was some issues with some of the cements that were used in root canals previously that caused nerve damage and numbness. It's been removed from the product, or from the market, excuse me, and at this time I don't know of any product that there's any issues with. The root canal material itself, again, is a rubberized material from a rubber tree and is an inert material that the body just doesn't react to.
Mm-hmm.
Dr. Luna, there's a question here about wondering if there's a natural substance that strengthens tooth enamel, such as stevia, but this person says, but stevia has been shown to also reduce testosterone levels. But I guess the main question is there a natural substance that helps to strengthen tooth enamel?
Yeah, at this point in time, I don't know of one. Again, one of my problems is, I have my practice, I see my patients, and so I go home to see my kids and don't do probably as much research as I should now, to be honest. There's so many new products coming out nowadays, it's hard to keep up with. One of the originals was a tooth and gum tonic. It was the first that came out and is still highly recommended by dentists. That's probably been out for about, it could be longer than I know, but I'd say it's easily been out for 20 years now.
And again, I guess it's probably, again, back to more nutritional things. A couple of questions were about vitamin C, if it helps is it advisable to supplement with vitamin C if you haven't taken your fillings out, and does vitamin C help reduce mercury in your body?
Yeah, from my standpoint, I would be leery for me to say that. You're starting to get out of my realm a little bit, and probably better questions to Dr. Day from that standpoint. I think that the vitamin C, when we remove fillings, is shown to bind to the mercury that is just released into the blood system and helps to excrete it. So at that point in time, I like a high dose of vitamin C given. Other than that, I'm leery to say that higher doses of vitamin C are great to keep on for a long period of time.
Right. Yeah, I would rather suggest that people do the other modes of removal of heavy metals than use vitamin C as a mode to remove heavy metals from the body. I would tend to agree with Dr. Blue on that as well.
Have you heard of a product called Tooth Soap? Somebody typed in recommending toothsoap.com. Supposedly they have an excellent product when brushing teeth. It helps to, they have a remineralizing product. It's all natural. Have you heard of that?
Yeah, I have, and it's kind of like the tooth and gum tonic. There's a ton of new products coming out like that that are trying to get away from the fluoride that's in the toothpaste. And as I previously mentioned, I think we're going to see that shift continue now, and see more and more ADA-approved toothpaste, at least, such as the Colgates and the Sensodynes and all that, go that way also, to where they're going to try to get less fluoride in there and go to different products that help remineralize the tooth.
Mm. Well, Doc, we're going to wind down now, but I just want to get this question out of the way because I think she's been waiting to have this answered. I had an abscess and had ozone injections a few years ago. Then later, the abscess kept coming back. I used therapeutic essential oils, which were effective in getting rid of the abscesses, but eventually the tooth broke off. The tooth happens to be a wisdom tooth, and now the whole tooth is broken with just a few edges sticking out. I did notice some more infection next to it, unfortunately. That part of the gum has a bridge. My question,